Hi everyone and welcome back to my channel. So today's procedure is last office. We are going to be needing a bowl of gas, a kidney dish containing forceps, dressing forceps of course, then non-toothed dissecting forceps, a pair of sinus forceps. We are improvising it with that forceps over there. Then in a tray, we have our bandage, we have a comb, our soap dish, yeah. Then we have a bowl of water, then our jug of water. Then under the trolley we have a receiver containing gloves, another receiver, then we have a receiver containing antiseptic lotion in it, a receiver with 2 identification labels and a safety pin, yeah. Then we have one shroud, that's the shroud over there. We have mortuary sheets. We have our face flannel. We are going to improvise that for our linen bin. A bucket for used water if necessary. Yeah, like I said, I've already explained procedure to the patient's relatives. Yeah, and I'll put on my gloves. I'm improvising for this glove because we don't have disposable ones. Yeah, then I'm going to put on my gloves and I'll strip the top bed clothing. Yeah, I'll strip the top bed clothing. The top bed clothing, that's the counter pin. Yeah, I'll leave the top sheet to cover the patient. I won't expose the patient completely. Yeah, not because the patient is dead, you will expose the patient completely. No. Then after removing the counter pin, you check whether the patient have any accessory like wristwatch, earrings. Yeah, then you remove the clothes. Before you remove the clothes, make sure you've already screened the patient, you've already screened the area. Yeah, then you remove the clothes gently. Make sure you don't talk during this procedure. You're about to respect the dead patient. Don't talk during the procedure. Then after removing the clothes gently, you bathe the patient using the face flannel. The face flannel, soak it in water, then using our soap in the soap dish, you bathe the patient thoroughly. Remember how you do your birth baths. That is how you are going to bathe the patient. Then you start with the face. Clean the face thoroughly. Yeah. Then the head. You squeeze your face flannel. You rinse it. You can throw the water away when it gets dirty. Then you start with the part farther away from you. Yeah, see, as I started with the part farther away from me, the arms, the trunk, I started with part farther away from me. If you need an assistant, you can still call. It's very important if it's a big patient. Yeah, if you need an assistant, you can still call. Then you continue changing your water, squeezing the flannel until the patient is completely clean. Don't say because the patient is dead, you are not clean again. No, continue cleaning the patient. And remember, you don't talk during this process. You respect the dead. You respect the dead patient. Do not talk during this process. Just continue cleaning the patient until the patient is clean. Yeah, until the patient is clean. like I said earlier, you can ask for an assistant if the patient is big. It's because it's just Mr. Jones, that is why I can carry him. So then after bathing the patient, you position the patient, preferably in a supine position. In a supine position. You can leave the pillow there, you can keep the pillow, it's your choice. Then using your non-toothed dissecting forceps, pick a cutting wound and place in a forceps so it can help you close the orifice. Please, before doing this, clean the orifice. Clean the orifice first before doing this. I would have done it but the clip missed. So before you pack the orifice, before you close the orifice, please clean it first. Then you start packing the orifice like I'm doing. Make sure for the mouth you put a lot of cotton because of drainage, obviously. Then you pick another one for the nose, a smaller one. It's not going to be the same size with the mouth, so you pick a smaller one for the nose. You repeat same for the other nose. You close the orifice. Then all the orifice in the body, even the ear. Then you go to the anus. If it's a lady, you see a vagina there, a urethra there, you close all the orifice. But here is a male, you close the anus, as you can see. Then after closing the anus, then we go ahead to close the ears. The two ears, we are going to close them. While covering the orifice, don't forget to check if there are injuries on the body so you can dress them, and also the hair, comb it. Then after that, you get your mortuary shroud. You wear the patient's mortuary shroud. Then after wearing the patient the mortuary shroud, you place the hands together over the abdomen. You will tie the hands together over the abdomen, either with a bandage or a tourniquet. Just tie the hand together over the abdomen. You tie the hand firmly, not too loose and not too tight. Tie it firmly over the abdomen, not too loose and not too tight. Then you're going to attach the first label, identification label. There are things written on the identification label: the name of the patient, the age, the ward number. You can see it from there. The ward, the gender is written there. So we'll place the first identification label on the patient thumb or on the patient's hand, like this. That is how it will be. Look at everything we are going to write there. Then the next, we are going to tie the legs. Some tie the toes together, but that is how Mr. Jones' toe is. We can't tie it, so just tie the two legs, the foot together firmly. We tie them together firmly. This is how his toes looks like. We cannot separate it because it's a mannequin. So we just tie the foot together. Then we are going to use our mortuary sheets to cover Mr. Jones from head to toe completely. We are going to close him with the mortuary sheets. Although this is not a mortuary sheet, but as nurses we just have to improvise. Yes, in a more larger hospital, in a more advanced hospital, you are going to be seeing a mortuary sheet. This is not a mortuary sheet. That's how we just tie it firm to be able to fit in as a mortuary sheet. We tie it, then we cover Mr. Jones' family. Then using those safety pins that we brought out, we are going to attach these safety pins. We are going to attach the second identification label on top of the mortuary sheet. Yes, like this. We are going to attach it like this on top of the mortuary sheet. Then we are done with the last office procedure. Thank you for watching. If you enjoyed the video, tell me in the comment section and tell me the next video you want me to do. Don't forget to subscribe. Bye. Thank you.